Hi, and welcome back to another episode on the Climate Conundrum podcast. I'm your host, Sanika Diwanji, and today we're diving into the aspect of climate resilience and health. Um, while this is a critical topic, climate change and health does not directly come on people's minds because there's so many immediate issues that first get looked into. But we have Abhiyant Tiwari joining us today, who's the lead climate resilience and health at NRDC India. He has a decade of experience, rather more than a decade of experience working with academia, with government and nonprofits, and has been at the forefront of evidence based adaptation and mitigation policies, particularly focusing on climate and health. Abhiyant actually played a pivotal role in developing South Asia's first heat action plan. It was developed in Ahmedabad, which is his hometown, and it really set a global benchmark for climate health strategies. So I'm very happy to have him here to discuss this crucial topic. And it becomes more and more imperative today to have this conversation considering all the news which is happening in terms of what's happening in Delhi, the different disaster elements that constitute health risk from climate change. So, a very warm welcome, Abhiyant, and I'm so glad you're joining us today.
Thank you. Thank you so much, Sanika. And I must thank you for inviting me to this podcast, but also thank you for initiate your this initiative of Climate Conundrum podcast series, which is uh, uh, which is very I find it very useful because we know that podcasts nowadays is something that the current younger generation and also the elderlies are found very useful to get information from, because there is no ifs and buts and cuts in the open dialogues that we do during the podcast. So yeah, thank you again, and also thanks for doing the series on such an important topic on climate and its impact on health and other sectors. Yeah, thank you.
Thanks for the kind words. Yeah, I'm hoping that these kind of talks and conversations help reach a wider audience. Not everyone has the bandwidth to go over dense reports or news series. So this is just a small attempt. And while it's slightly ironic that I want to reach people whose attention spans don't last beyond a couple of minutes, it is still imperative that conversations don't get cut short. Owing to time restraints, I'd like to give it the justice it deserves. Anyway, so moving on, I think, Abhiyant, every episode I dive straight into the crux of the matter and then start unpacking the topics around that issue. So I want to actually know today we're going to do slightly something different because your journey has been interesting. Climate resilience and health has been really something not known to Indian audiences for an immediate as an immediate concern. And you started working on this much before people were talking about it in mainstream areas. So, what is your journey? What led you to this path?
Well, you very well, spoke about it in your inaugural remarks that while we still have challenges, mounting challenges in other, of other issues, including in health, who talks about climate? And when I started almost more than a decade back, almost in 2012, 13,
Mm.
and that too on heat, climate impact, heat. See, if there is one climate change impact that is for sure, and there where the science has full consensus and has no doubt that it is getting exaggerated, it is getting more frequent, more intense, more severe because of the human-made climate change, then it is heat wave, where the science has full consensus that heat waves and extreme heat spells are getting more and more intense and severe, and because of the climate change. But this is what we talk now. Almost a decade back, when we had challenges of, we still have those challenges of non-communicable diseases, communicable diseases, lifestyle, diseases, vector-borne diseases, malnutrition. While you have so many on your plate, who talks about how the climate change and its impacts are affecting the health and livelihood of the people? No one, right? So convincing the policymakers, the decision makers, that it is a mounting challenge which will impact harshly in times to come if we don't start working on it now, was a great challenge almost a decade back. So yeah, the journey started from one city, the city of Ahmedabad in the western part of the country in the state of Gujarat, where I'm born and brought up. I was doing my postgraduate diploma in public health management, and if you know about Ahmedabad heat action plan, that's the first, citywide comprehensive heat action plan across South Asia. So that was the heat action plan that I started working on during my postgrad. Um, I joined the project as an internee. The project was an outcome of an devastating heat wave that the city experienced back in 2010. Luckily, we had a government, a local government in the municipal corporation, which was ready to work on it, which took the cognizance of the event that happened in 2010. And when, the evidences were shown to them, they were ready to, work on it. That this is something that they don't want to repeat in future, their hospitals were overwhelmed, their emergency rooms were overwhelmed there because they were not prepared. They had not seen such, devastating event like heat wave in past. So they were not trained, they were not, prepared to deal with it. But they don't want it to happen, same to happen in future again. So that's where it all started. We had a local, so currently I'm working with an RDC, which is one of the pioneering institute that helped the local municipal corporation with the support of the local knowledge partners like Indian Institute of Public Health, um, Gandhinagar. So all these and many other partners came together and worked with the city government, worked on assessing the vulnerability, worked on looking at what happened in 2010, what went wrong, and what could be corrected in future, who all should contribute in the in the policies and actions that need to be taken in future to protect the citizens from the rising heat. So that's where the entire journey started. The first heat action plan of Ahmedabad came into the picture in 2013, and subsequently, with each every passing year, learning from the previous year's experience, got revised and also scaled in the country with the support of subnational and national leaderships from state and national government agencies like disaster management authorities and meteorology department and health departments and all. So yeah, that has been the journey of heat action plan. But yeah, I also eventually did my master's in environmental health sciences from Howard THN School of Public Health. That also gave me a lot of exposure to the deep science of you know environment and health, and that helped me advance more the science and evidence-based policies and actions uh, with the stakeholders. Yeah.
That's great to know. Thank you. I think I'm sure a lot of listeners who might be interested to get into this and have questions about the avenues could use this answer. But speaking of the climate and health sort of connectedness, right? The impacts of climate change on health almost seem like a web. The more you try and unravel it, the more interconnectedness you find, from heat to what you said, epidemics and vector-borne diseases, to even pollution-induced risks to the health. A recent Lancet report, actually, Lancet releases these reports every year, and the data from 2023 in this year's report talks about how, for example, in 2023 alone, each person in India, on an average, was exposed to almost 2,400 hours, equivalent to about 100 days of heat stress. And this is just going to get worse and worse. And we all know this now, that enough media attention has been given to heat risks and the impacts it can cause on vulnerable groups. This is one part, but then there's also the smoke, the pollution, the air we breathe because of heavy particles in urban areas. So this is an alarming scenario, even to use the most subtlest words, right? How do you see climate change shaping India's public health policy?
Yeah, so that's very pertinent and important question. So the way we see climate change, well, let's step back and understand what is climate change. climate variability, and weather, right?
Mm.
So climate change is something that we expect to happen over a period as in over at least, let's say, 3 decades. So global warming, average increase in the temperature, um, rising sea level, you know. So these are some of the impacts of climate change that we see happening because of the human-induced climate change. There is something also called as climate variability. For example, the El Nino and La Nino events that we have seen recently happening, which also influence the weather conditions of a given, season or of a given year. And then we have weather conditions. Now, whatever happens, for example, the heat wave spells of 2022 or 2023 or this year, how much of those extreme weather events are attributable to climate change is also something that the scientists do analyze, right?
Mhm.
For example, if I'm not wrong, then the 2022 heat wave event, which was very significant, the India and Pakistan heat wave event were 30 times more likely because of the human-induced climate change. Had human-induced climate change had not happened, those kind of heat wave events would have not happened. The Lancet report says that, in 2023, more than 100 days people were exposed to heat wave.
Mm.
Now, their definition could be different, but what the India Meteorology Department says that this year itself, there were more than 530 heat wave events, that happened uh, in India, across India, in all the meteorological subdivisions where the India Meteorology Department has their meteorological observatories. So more than 530 days, which is second highest after 2010. So there is no doubt that the events are increasing, the extreme weather events are increasing because of the climate change. The attribution sizes science is also confirming the same with every passing year. But these events don't happen alone, right? These could be seen as an hazard. Now, when does a hazard converts into a disaster, right? When you are not prepared. So when you have higher vulnerabilities, when you have higher exposures. For example, people living in the urban area are highly exposed to heat compared to people living in the rural area because the exposure is high. There is higher population density, there is higher built environment, right? So there is a higher exposure, which also contributes to the urban heat island, which is an effect amplifier
Mhm.
to the environmental heat that people are already exposed to. Then you have underlying vulnerabilities. People with extremes of age, with comorbidities, are at high risk, right? Uh, but all this could be addressed. The air pollution, right? That compounds with the heat and has a compound effect on health. Uh, so while all this is there, we need to understand that the risk of adverse outcome from all these, climatic conditions or extreme weather events could be reduced if we have a better adaptive capacity,
Mhm.
right? And how this could be done? By having better policies and programs in place on ground, which are implemented, including the one from coming from public health, sector uh, to address the impacts of climate change from the public health side. India has a national program, which is called National Program on Climate Change and Human Health, which has
Mhm.
various programs for various climate sensitive events and conditions. For example, for heat wave, they have a national action plan for heat related illnesses. They have a plan for air pollution. They have a plan for vector-borne diseases, where the national agencies work with the state and their counterparts in the districts and cities
Mhm.
to build the capacity of their health facilities, their health workforce to deal with such challenges, such mounting challenges, to improve the surveillance, to improve the treatment protocols, to improve the diagnostic facilities, and not just that. So when I said climate is not just affecting the health of the people, it is compounding and it is also affecting the infrastructure. So
Right.
our health system itself is not, immune to the impacts of climate change. Be it the human resource, be it the physical infrastructure, that is also, at the risk of the impacts of climate change. So,
I mean, COVID recently did prove this to us,
yes,
right? Where
right.
the preparedness is so much important.
Yeah, yeah.
Now that we are going to face every year extreme weather conditions, be it the summer, monsoon, or winters. I'm sure this is a direct impact on rural as well as urban health centers.
We very frequently see the, urban floods, which, almost disrupts the services, including health
Mm,
services.
mm,
If an hospital is already flooded, where would the victims go? Where would the sufferers go, to seek treatment or to seek the help? So that's something that our system has to prepare for, and that's what the governments and the agencies and the stakeholders are trying to trying their effort, not just to protect people but also protect the systems from the impacts.
I hear you that we have plans from different ministries as well as different areas, priority areas. But among them as well, how do you see India prioritizing these policy measures? What are the key areas we are tackling, and how are we even trying to get a grip on this? Because India is such a huge country. We have challenges that are very unique compared to many other places in the world, since we have different climatic conditions and a lot of poverty as well as population.
Yeah, so there is no one size fit because of the diversity in India, both in geography and also in the system of governance. So there is no one size fit for that in India. It could be an issue, in the central, western, and some of the southern parts of the India could not be that serious issue for many, northern parts of the India. So local preparedness is very important to the local hazards. Landslides don't happen in the plains. So wherever there is an hilly region, they have to prepare for the landslides, right? Their facilities have to prepare for those, landslides and floods that happen in the mountains. So that has been the response, the local response from the, national and subnational agencies. For example, NDMA, the National Disaster Management Authority in India, does prepare for the localized hazards with the local, with the regional counterparts as the state disaster management authorities and district disaster management authorities, and keep doing the regular review of the programs and plans and policies that they have put in place. India Meteorology Department, they have advanced a lot in their early warning systems, impact-based early warning systems.
Mm.
Their forecasting, accuracy of their forecasting has improved a lot over a period of time. I know about heat particularly, it has improved a lot. It has also improved for the rain, precipitation, and other weather conditions. So it has to be a multi-pronged, response. But the most important part here remains is coordination among all the stakeholders.
Correct. I'm
There
sure
is
that is a
warning.
mammoth
Yeah,
task.
yeah. So if there is an alert from the meteorology department, let's say, uh, India Meteorology Department, or again coming back to the heat, they issue a seasonal, outlook every summer. For example, in March itself, they will provide 3 month seasonal outlook that these
Mm.
across India, which are the regions that are going to, experience higher temperature than the average. So they'll not tell you on 1st of March that what would be the temperature on 25th April in Nagpur, but their forecast at least gives you a signal. Their seasonal forecast gives you a signal that in April, on average, the temperature would be, 2 or 3 degrees Celsius higher than the average temperature, historical average temperature, and the probability is this. Now, who is the recipient of that information, and what that agency is going to do with that information is important. And is there a mechanism to coordinate the action among all the stakeholders? Because and labor department is not going to tell health department what you have to do. Health department is not going to tell, let's say, education department what you have to do, right? So there has to be some mechanism to coordinate among all these, important stakeholders that need to be looped in for better preparedness and response in times of any adverse event happening. So This is where our disaster risk reduction measures are improving in our country, I would say. But
Mhm.
simultaneously, the challenges are also mounting.
Right. Speaking of challenges, now I have a twofold question, I guess. How would climate be different in terms of the training and capacity building compared to these events that will anyways be happening across India, historically have been happening? So these kind of preparedness event among the government authorities will anyways be happening. So why would climate change be any different in terms of the capacity building?
The answer to this question is first, uh, do we all agree that these events are increasing in frequency and duration and severity due to climate change and are going to increase by every passing year? Do we all
Mm,
agree with that, right? We were assuming that, in 2015, the Paris COP, we said that will restrict the global warming by 1.5 degrees Celsius by
mm.
somewhere in towards the end of this century, but it is almost going to happen this year itself. The signals are clear that this year might cross 1.5-degree threshold.
A lot of data also shows that we have crossed it. So I guess.
Yeah, yeah. So there are very high chances that by after the year ends, we'll have it confirmed that the entire year was 1.5 degree above the 1.5 degree threshold. Uh, so yeah, the events are going to happen more frequently and more intense, more severely. Why should we do the capacity building if they are anyway going to happen? The answer to that is risk literacy, right? We in general, I won't say India, but in general, people are not that risk literate. When I say risk literacy, as in, do I know what is my risk to any action or any movement that I am doing today? If I'm getting into a lift, do I know the risk of getting to that lift if anything happens to that lift? If I'm entering in an auditorium or a hall which is packed with, hundreds and or thousand people, uh, do I know if there isn't fire exit and where is it? Where is the
Hmm.
assembly area? Do I know that, right? So, the more you are prepared, the more you sweat during your, peacetime, the less you bleed during your wartime.
Right.
So capacity building always helps, and the more and more you do that, and particularly with people responsible to act, in emergencies, and also in general, making people aware about the risks and what are the common do's and don'ts that they should, follow in any such kind of events. For example, we have great examples from Japan. Such uh, severe earthquakes of high intensities happen there, but
Hmm.
don't see any losses of life. Even the infrastructure they have built it to the level that we don't see the impact on largely on the infrastructure as well. That is because of the risk literacy, the capacity building that they have inculcated in their communities, not just among the science and the policy and the practitioners community, but in general in the community, which is very important.
Yeah.
So, and while we know that the risk is going to get increased, obviously building the capacity of the people, making them more risk literate, is the first step in order to deal with the future risk and reduce it.
Absolutely. I think my second question on the same lines is now that you say we have the capacity building programs in place, we have the national program on climate change and human health as well. But then there are these recent events each year, like the Kerala floods happened, landslides, or Assam, Gujarat, getting affected by extreme flooding conditions with over like 7.7 million people displaced because of it. And these are just rough figures, right? There's no way to find out the actual numbers. Um, this kind of does show a little bit of a gap in terms of preparedness, or maybe it also shows a lack of understanding of the gravity of how these extreme weather conditions kind of affect people and institutions. So, in your experience of working with government organizations as well as common people, how do you address these in your work?
Yes, so that's where, no matter how much you prepare for it, if the vulnerabilities are higher, preparation is part of adaptation. You're preparing for an imminent event to happen, right? Uh, so that's one component of reducing the risk from any hazardous event or reducing the disaster risk from any hazardous event. But that itself won't suffice with the mounting risk. As I said, the events are getting more intense. Uh, are we also working to address our vulnerabilities? When I said vulnerabilities, are we still building our, houses and buildings at the river banks? Are we still, building houses in the high, earthquake risk zone areas?
I mean, Mumbai is a classic
Yes.
example, right? People still are
So
paying high amounts, extremely high price rates for the most vulnerable areas in the city.
exactly. So preparedness and response are very in time scale are very close to the event happening,
Hmm.
right? If you start preparing once you have an early warning, there is going to be a high precipitation and possibility of flood. Then you start preparing, moving out from the low-lying areas. If they're in cyclone alert, then you move out from the cyclone track and you evacuate people. So the preparation usually starts, preparedness measures usually start in a DM cycle, in the disaster management cycle or a disaster risk management cycle, around a close time scale of the any hazardous event happening.
Hmm.
The early warning is issued, and then once it occurs, you start responding to it, right? But there is something also called as prevention and mitigation, that requires long-term measures. So how you build your cities, what are you, how do you follow the building laws? How do you follow the infrastructure, measures? How do you work to reduce the future emission, have more greener, development plans, so that you are not just reducing the impact in current time, but also for the future. So prevention and mitigation measures are very important in that aspect. Uh, uh, Alone preparedness and response are not going to address the future risk. The because the climate is making the events more, I'm again and again saying this, more intense and more frequent. There has to be some limit that in future we need to address this. Uh, Develop more resiliently instead of just keep doing the retrofitting. So when we build back better, we build back better and resiliently for the future.
This is a great point. Yes. So resilience actually involves preparing in terms of infrastructure, policies, and public institutions and their preparedness, as well as capacity building.
Yes.
Abhiyant, one thing that I always wonder is, like we already discussed and established that India is at a high level of risk. High levels of population and poverty do not help this mix as well. But in addition to all of this, India is also one of the most, rather, Indian citizens have the highest out-of-pocket expenditure for healthcare. Now, when you combine this with the idea that we are going to face many more challenges with climate and health impacts, how would you say a strategy can be developed to make sure that vulnerable groups who have to pay and do not have the incomes to sort of get help at medical centers or private hospitals can be alleviated of these burdens?
That's a very good, important question. Broadly saying, our healthcare expenditure of total, GDP is fairly low compared to the developed countries. That's well-known fact. But also the good part here is that that expenditure is increasing over a period, right? Including the out-of-pocket expenditure has gone down over past, at least in a decade, it
Mm,
has gone down. How the government is trying to protect people, particularly the vulnerable ones. You must have heard about the national, health insurance schemes, such as Ayushman Bharat,
mhm.
right, which is protecting the families with the health insurance cover, and that's basically is the one of the largest schemes across the world. that covers millions and millions of people with health insurance and the entire families, particularly people coming from the low socioeconomic
Mhm.
background. But I think right now it is available for all. We can do the fact check on that, but that's something that government has put together. So that is on the on the treatment or health care part. What is the public health or prevention part? So the same scheme also is revamping the entire public health infrastructure, both human resource and the physical infrastructure. So the sub centers, which are the lowest unit of the public health infrastructure in India, and primary health centers, they're getting converted into the health and wellness centers,
Okay.
where previously you had limited, health services available, for example, immunization and some, preventive care. They are also covering other aspects of health, including the, non modern medicine aspects, for example, Ayush, yoga, and those
Hmm.
things are also getting covered into these kind of initiatives. So the NHA, the Ayushman Bharat, is a great initiative that the government of India has taken, has been a great example for the world as well, that how the government of India and is taking care of its population, both in preventive and curative care through health and wellness schemes and centers, and also health insurance coverage to the families.
So we spoke about the effective places in which we are doing good, and credit is due where it has been showing improvements, right? Where are the gap areas? Where do we still need focus on and work needs to be put in?
So, see, more sensitizing the health system more on the climate related health issues, which has been the government has been doing through this national program on climate change and human health, as I mentioned.
Mm-hmm.
See, the treatment remains the same for a vector-borne disease, or a COPD, exacerbated case of COPD, chronic obstructive pulmonary disease patient, whether it happens because of an air pollution event happening, or whether a vector-borne disease happening because of an uh, extreme, an event that could be attributed to climate change. For example, in Himalayan region, we don't used to see vector-borne diseases happening earlier because that the weather conditions were not conducive to have, vector-borne diseases, but now we see there, right?
Mm-hmm.
But the treatment part doesn't change in that aspect. What needs to be done is to sensitize the health system and also the people. So as far as the system is concerned, the national program from the Ministry of Health and Family Welfare is addressing that part by sensitizing the facilities about, for example, what happened in 2010 Ahmedabad heat wave event. Doctor were not, the health professionals were not ready, or were not trained to differentially diagnose the cases of fever coming during that extreme heat spell that happened in the last 2, 3, third, fourth week of the month of May in 2010. So when the cases of high temperatures were coming, they were mostly were not able to differentially diagnose it, that this is not a viral infection, or this is not any other infectious hyperthermia or fever condition. This is because of the rising temperature or exposure to the heat, and could turn into a heat stroke. So
Mm-hmm.
training them is very important. Training the health facilities, the health workforce is very important. The Himalayans, facilities in the Himalayan belt, who have not seen vector-borne disease in past, will not think of would have not thought of getting a fever case, possibly because of a vector-borne disease, could
Mm-hmm.
possibly be of malaria or dengue. So that training is very important, and simultaneously, raising awareness among public is also equally important, that this could happen. these are the signs and symptoms, these are the do's and don'ts that you should follow. So that, dual approach the government has been putting together,
Mhm.
in best of my knowledge. And yeah, I mean, again, as I said, the challenges are rising at much faster pace than the we are preparing for it.
Definitely. Are there any other gap areas where we need to put in work, and how do you see us actually um, putting that together?
Well, you know, I think governance is an important part here. So, let's say we are uh, preparing a plan, policy, or guideline for any particular uh, extreme, climate event. Uh, the governance is the most important part. So, how do you, because many of these areas which are getting impacted by, such events uh, are either health, right? Or disaster,
Mm,
these are all state subjects. So many a times sensitizing states and 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 union government, uh, providing an enabling environment
mm,
for states to adopt or to develop their local policies and their local governance plans, local governance infrastructure system to deal with such events is very important. Um, For example, heat heat wave is not a notified disaster nationally in India, right?
mhm.
Uh, but there is a provision that and disaster is a state subject. But there is a provision in our Disaster Management Act that states can notify a disaster at a local level as a state-specific disaster.
From districts to rural panchayats.
Yeah, so for example, Kerala has notified heat wave as a, state-specific disaster.
Mm-hmm.
So Kerala can utilize certain funds. Kerala can enforce the DMX, the national or the state-specific DMX policies to enforce the actions on the ground
Mm-hmm.
for heat wave. Madhya Pradesh recently did that. Uttar Pradesh has done that. Many states have done that. I think 6 or 7 states have done the notification of heat wave at a local level, as in a state-specific disaster. Although it is not there in a list of the nationally notified disaster.
Okay.
So that makes a very important role. Like, how do you govern it? What happened in COVID, right? Um COVID was a pandemic. The first thing that was done was notification of COVID as a disaster
Mm-hmm.
at national level. So if you remember, under DM Act 2005, heat wave was notified as a national disaster. Right?
Yes.
So that enabled the entire governance system mechanism to work on it. It gave power to the authorities when you have a situation which is notified, which is backed by an act or regulation, then the
Mm-hmm.
authorities have power to regulate the actions. All the lockdowns and everything that we saw were backed by the Management Act 2005. The DMs, the commissioners, the collectors had the power through that, notification. Then states, brought up their, I mean, enforced their state specific, if they had a state specific, acts that were relevant. For example, Gujarat had uh, uh, an epidemic disease act, which was at India level also we had an epidemic disease act, which was very old, right? So that got amended during the time of COVID.
Mm.
These all, governance instruments give the
Have to be.
power to regulate,
Mm-hmm.
give the structure of regulation. Once the COVID was notified, we have a national disaster management plan, which says that if any biological disaster happened, COVID put was put under the biological, disaster category. So if
Mm-hmm.
any biological disaster happens, the health ministry is the nodal agency, right? So automatically health ministry became the nodal agency. Now,
Mm-hmm.
what tools does the health ministry has to deal with any biological disaster? They had epidemic disease act, which was old. They amended it. Then
Mm-hmm.
whatever the states have. So there were two umbrella, acts that were helping the states
Mhm.
and national agencies, DM Act and the Epidemic Disease Act. And then the states had their own acts and regulations also, which they did use to, put the things in control. So governance is a very important tool whenever we talk about. So whatever we see, whether we are talking about the outcome, dealing with an outcome or an event, or whether we are talking about reducing the risk, the preventive measures, building regulations on all those things. If it is regulated and there is a mechanism put in place to coordinate all the actions, uh, is something is very crucial in dealing with these issues.
That makes sense. So we spoke about government agencies, about the center-state divide in disaster management action as well as implementation. But at the same time, community-led or community-driven solutions usually have the farthest last mile impact. Are there any plans, or what do you think works the best in building resilience? And are there any stories that you feel particularly proud about in this?
Yeah, yeah, absolutely. And in fact, it is very important. It is not always the top-down approach that works, right? It has to be bottom-up. So if something comes from the community, as an example, right? Community has to be part of all the, they're a very important stakeholder. So they have to be part of all the, planning uh,
Mm,
and then implementation process that takes place throughout the journey. There are many such examples. For example, right now, one of our recent work on heat action plans uh,
mhm,
in the city of Jodhpur in Rajasthan, right? It's a small city. It's a tier two city. Well, then again, good part about tier two cities are they are growth engines. So if you start
mhm,
working with tier two cities on climate, resilience plans, heat action plans, then they can, develop more climate resiliently or heat resiliently in future. Anyway, so in that city, one of our, community, technical community partner, which is Mahila Housing Trust. So they are a women-led organization. They work with the slum women in improving their housing conditions and improving their livelihoods and improving their climate resilience and so on.
right.
So and they have been working there for almost more than a decade in Jodhpur. So with them, we started, community pilot projects of,
Mm,
passive cooling solutions like cool roof, uh, and developing their capacity uh, to understand the early warnings,
mhm,
of heat waves and making, public awareness and community outreach programs, developing the sensitization materials for the slum communities. So we did this pilot work and showed it to the authorities, did consultation with the authorities where all the stakeholders came, the commissioners and mayors of the municipal corporation, they also came and they found it very, useful. And then the, ask from the municipal corporation, the local government came that let's scale this to the entire city and let's convert this into an heat action plan. So this was an bottom-up approach, right?
right. And then cross mapping it into other states
Exactly,
or districts can also be efficient
exactly,
because you already have a plan of what works.
exactly.
Right.
So, when you have a trusted community partner, community engagement, and when the ask comes from the community, the
Mm,
our governments usually are very receptive and very, progressive in this term that when there are successful solutions shown by the communities or pilots shown among
mm,
the community, then they are receptive of scaling it when
mhm,
you already have a success stories in place. So it works. There are many such examples. So another work area that we work on is energy access.
mhm,
So SEWA, if you know, Self-Employed Women's Association, we are working with them with the rural communities again, particularly with women, uh,
mhm,
in helping them alleviate their energy access issues. providing them a suite of DRE solutions, distributed renewable energy solutions, including, solar panels, solar lights, solar irrigation pumps,
Mhm.
uh, you know, solar cooking stoves, and many such solutions, which are green, and they're helping them in reducing their energy cost, and their drudgery, because many times they do not even have access to continuous electricity. So,
Right, right.
and we are also training them on how to manage these solutions, and also how to repair them, how to sell them, creating an entire market for it.
Mm-hmm.
This is
Right.
not just helping them in getting them benefit by the energy access directly to them, but also giving them a livelihood option.
Absolutely.
So these kind of examples, and we are doing this, and the Ministry of New and Renewable Energy is supporting us for this, appreciating us for this initiative, and have been supporting us for this.
Absolutely. In fact, I did a project with the International Solar Alliance where we tried to actually map out good case studies where solar was used for, like you said, giving access to solar equipment and technologies to local women, but also healthcare units where
Yeah.
a lot of times in India, healthcare or disaster resilience and risk is amplified mainly because of, say, lack of electricity that day to give patients the access of things that they need. And using solar for these kind of things is more, um, it really changes things in rural areas where a basic light bulb becomes an issue to run when you don't have
I
electricity.
think because of your effort and many, such agencies putting such effort, this has also become a part of this national program on climate change and
Yes,
human health. So there is
absolutely.
a component of, climate resilient health facilities, which ensures health facilities have, are solar powered and are resilient to climatic events, for example, flooding and others,
Hmm.
based on the local, hazard scenario.
Absolutely.
Yeah.
Um, we have many challenges ahead of us as a community, as a country, globally as well. But I really try and keep the conversations solutions oriented or a little more hopeful because we need that silver lining. So, for listeners who might want to be more active, and I'm guessing that if someone is listening to this podcast already, their propensity to go towards awareness is higher. What can be some small yet impactful actions that people can take to protect themselves, their families, say during any disaster event?
So I'll go back to my answer in one of the previous questions that we discussed. Risk literacy is the first thing.
Hmm.
There are many. I mean, we are not aware about how do we move, where are we, what is our surrounding. For example, fire. Any small fire can convert into a disaster, right?
Hmm.
It has happened in many incidences. We have seen that. So what do we know about fire? What do we know about the fire science? There are some very basic fire science, theories and information that everyone should know about, at least all the children in school going childrens, and even the students of college should know about. Definitely there is very basic sense of fire, the fire triangle, how what three components are required for a fire to happen, and then how it behaves, like what are how the fire progresses. So if
Hmm.
somebody knows about even those basic things, can protect or prevent themselves and their close ones from such events, what you should do during if an earthquake event happens. You shouldn't be running to a lift, elevator,
Hmm.
to get
Hmm.
down from a building, right? uh, on which floor you are, where should you stand, how do you place furniture in your office, in your house, that can reduce the risk of an injury happening during an earthquake to a great extent.
Hmm.
For example, if there is a cupboard uh, lying next to adjacent to a wall which is lying next to the workstation that I'm sitting in. If that cupboard is fixed to the wall with two clips, not much, but two clips,
Mm,
right? In a tremor during earthquake, it might not fall.
right.
If I'm sitting here, it might not fall. By just fixing two clamps uh, on that cupboard with the wall. So it will make it static there. It will not
Mm.
fall unless the wall falls or the ceiling falls, right? But at least it is reducing the risk of that cupboard falling on me, right? Or someone. So the literacy about risk is very basic and should come into the curriculum, which I believe is coming into in our, new education policy and education curriculum. These things are getting covered. I'm seeing that, being a father of two children. So that's good. But yeah, risk literacy is the first and foremost thing. And then repeated capacity building, drills and these things happen in to keep people aware about what need to be done in any adverse situation.
So literacy, awareness, and a proactive approach to sort of
Yeah.
understand your localized risk. If you live near sea level, sea areas, then the kind of risks you face versus if you live in a mountainous terrain.
Yes, yes.
So understanding your environment, I think, would be
So
more
yeah, understanding the surrounding and not just risk literacy in terms of how to protect yourself, but also risk literacy in terms of not adding any future risk,
correct.
right?
Right.
So not just, fixing the cupboard to the wall, but also not building a house at the riverbank
Mm.
where there are obviously high chances of getting a flood, not building a high-rise building in a high, risk core earthquake zone area, right? So that is also important.
Well, thank you so much for your insights. This was really a fruitful conversation. And if there are any resources that you would like me to link, I would love to help share that with the listeners. So thank you for your time. And there's a lot of work to be done, but I can see some progress as well.
Yep. Thank you. Thank you. And thanks again for, initiating this podcast series and looking forward to watching this and all of your other podcasts and all the best for the future podcasts. It's again contributing to the risk literacy that we are talking about.
Yeah, that's true. I hope so. Thanks.